Hello, 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 and welcome to week 2 of HIT 500 Health Statistics. So we have our math trivia. We're going to do our apply and reflect recap from week 1, just in case there was any questions. I went ahead and grabbed some of the questions to kind of clear up any misunderstanding of the particular problems. We have our chapter 3, patient census. And then, of course, we're going to go into week 2 of our preview/review if you've already done it. Now, your knowledge checks. Don't just go through them, y'all. I know that there is a lot of math. Work on them. Try to get a 90% or above. I'm going to be trying to reach out to anyone that has scored less than an 80% by Thursday. So remember that these knowledge checks will help you with that weekly feedback. Your weekly feedback is due by 11:59 PST on Sunday. And please don't forget to work on these apply and reflection. It's all going to help you to be prepared for our midterm and so that you can advance in the program. So we're going to wrap it up. What number doesn't have its own Roman numeral? It is dun, 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 0. How many times has this happened to anyone? That awkward moment when you finish a math problem and you answer isn't even one of the choices. So you've gone through, you've done all this work, and you're like, wait a minute. I don't even have this as a potential answer, right? It's just a little something to think. You're not alone. Now, when we look at our apply and reflection from week 1, I went ahead and grabbed some of the questions just so that you can make sure that you are on the right path. You'll see that when it gets into your simplest form, especially with the first one, we are looking at 1/2 because 56 times 2 is 112, and 56 can go into itself. 56 times 1 is 56. So that gives you 1/2. When we want to turn that to a fraction, 2 divided by 1 is 0.5. And it tells you that it wants 2 decimal places. To turn something from a percent to a decimal, you're going to the right 2 places. So 45.6% actually turns into 0.456. Same when we look at 0.015. Now we're going in the reverse. So we go to the left 2 spots, and that gives you 1.5. The last one, 125, is 40% of what number? Take your calculators, and you'll know that when you divide 125 by 40% or 0.40, you get 312.5. The second portion of this particular recap talks about accessing the website for vital statistics of your particular state, and you're listing 5 stats that your state provides. Then you're going to access the body of knowledge, the BOK, on AHIMA's website. And then you're just searching for, or you just searched for articles that contain statistical findings. So everyone that's done the assignment already, good job. All right. Now, we are going to get into chapter 3. Getting butts in bed. Like, we want these patients in. So what is census in healthcare? Health statistics are increasingly important in measuring the nation's overall well-being. The Census Bureau provides accurate, detailed, and up-to-date statistics covering people, businesses, and anything relating to health in America. With that, we have some learning objectives. We are looking at calculating inpatient admissions, census, looking at what a master census is, daily inpatient census, inpatient service days, total inpatient service day, and admission and discharges on the same day, known as A&Ds. We're also differentiating between an inter-hospital, interfacility transfer and an intra-hospital transfer. We are going to calculate daily census and inpatient service days using the admission and discharge data provided. And then we're going to finish up with calculating census and inpatient service days with data that's been given for newborns and transfers. When we look at our inpatient census, the biggest thing I want you to know is that it only includes inpatient. Okay, I repeat that. It only includes inpatients, meaning patients that are already there. When we look at our daily inpatient census, this is going to be the number of inpatients present at the census taken time each day, plus any inpatients who were both admitted after the previous census taken and discharged before the next taken census. So it's like in that time period. You'll see that each PCU, they have information that they have to report, the number of patients that have been admitted, the number of patients that have been discharged or transferred. This is what is called the ADT. You will see this question again. So I repeat, it's going to be called the ADT. Patients who are moved from one PCU to another within the facility is going to be a intra-hospital transfer. You see that the information is combined to compile a census of the entire facility. The daily inpatient census reflects the number of patients treated during the 24-hour period. I will repeat. The daily inpatient census reflects the total number of patients treated during the 24-hour period. Now, your inpatient service day is the 24-hour period between the time the census is taken hours on 2 successive days. So it's on 2 days. One patient service day is counted for each inpatient admission when a patient is admitted and discharged in the same day. Now, this is just the definitions. We're going to get to actually working the problems, but we have to kind of understand, because you will see questions on what's an inpatient service day, what's the daily inpatient census, what's the complete master census. So understanding these terms is really going to help you be successful in this particular class. A unit of measure that reflects the services received by one inpatient during a 24-hour period is an inpatient service day. So the number of inpatient service days for a 24-hour period is equal to the daily inpatient census. That is 1 service day for each patient treated. You see that 1 unit of 1 service day is not usually divided or reported as a fraction of a day. You can't really have a fraction of a day, right? So it also tells us that the day of admission is going to also be counted. The days a patient doesn't occupy a bed, maybe they had a leave of absence, they had to go check something out real quick. These are going to be excluded because he or she is not present at the census taking hour. Remember, butts in bed is the theme for this week. Adults and children are also calculated separate from newborns and bassinets. Other names, right? So you may hear, depending on what facility you're going to, you may hear a patient day or an inpatient day, bed occupancy day, or maybe simply a census day. So what does this look like? All right, so the number of inpatient service days, as I mentioned, for a 24-hour period is equal to the daily inpatient census. That is one service day for each patient treated. It's going to be the total of the inpatient service days. So inpatient service days are compiled either daily, weekly, monthly, and annually, okay? So we get ready to calculate. You're looking at the measurement of service days received by all inpatients in one 24-hour period. It includes patients that have been admitted and discharged on the same day. Date of admission is counted as an inpatient service day, but date of discharge is not. I repeat, the date of discharge is not. So you're looking at the information in front of you. You have inpatient service days for adults, 12,345. Discharges are 1,351, and then discharge days is 9,457. You'll notice that I excluded the newborns because remember, if we're just trying to get in service days for adults and children, we're not going to include newborns. When we get to intra-facility, now we're talking about transfers in and out. And on any specific medical care unit, it may or may not be equal, but they must be equal for the overall hospital capitation. So they've computed everything and everything has to be equal in the whole. It may involve transfer of a patient within the same facility or any diagnostic procedure or transfer to another facility within, more advanced care. So let's say they're on a general surgical ward and their treatment is becoming more extensive. Maybe they've become septic. Maybe, there was an infection at the wound. So then they're going to be transferred to a higher level of care within that facility. Maybe now they have to go to the ICU, okay? Transfer of patients within the same facility, all right? When a patient is admitted to inpatient hospital care for a minimum of 8 hours, but less than 24, so you're looking at 8/23/59 or 8/01/23/59, and discharge on the same calendar date, the physician shall report the observation or inpatient hospital care services. So that's including admission and discharge services on the same day. You hear other names, maybe in and out, admission, discharge, counted inpatient service days or not counted inpatient service days. So it's going to really depend on the facility and their culture of what they're used to saying. The average number of inpatients present each day for a given period of time is calculated with the average daily census equaling the annual admissions times length of stay divided by 365, because 365 is a year, okay? Unless it's a leap year, and then you know that it's 366. When we look at newborns, remember the newborns is slightly different. The total number of patients admitted and born during the month of year is added. So the patient's remaining census with each month of a year began. From the sum, the number of discharges, including deaths, during the month or year is going to be subtracted. Now, one thing that you're going to want to do is really pay close attention to the very next slide. Why? Because this is going to be where your formulas are at a glimpse, right? You look at the average daily inpatient. Your numerator, remember we talked about that last week. Your numerator is going to be the total number of inpatient service days for a given period. Your denominator is the total number of days for the same period. For average daily inpatient census for newborns, right? It's going to be the total number of newborn in service days for a given period divided by the total number of days for that same period. And then your average daily inpatient census for a PCU is going to be, in your numerator, total number of inpatient service days for a PCU for a given period divided by the total number of days for that same period. Okay. This is just a quick reference. Now, one of the things that I really like to do in health stats is go over the formulas. Moving forward, you'll notice that there's a lot of formulas within the chapters, so we'll have a lot more to work with. But for this week, we're just going to go over week 2, looking at chapter 3, and breaking down how to go through navigating through these assignments. So your very first question, well, not your very first question, but we look at in 2000, we can fill in the date. A hospital had 175 beds for adults and children from January 1 through June 30th. On July 1, the hospital increased its beds to 250, and the number remained at 250 through December 31st. During the first 6 months, 30,875 patient days of services were provided to the hospital's adults and children. During the past 6 months, 36,982 days of services were provided. Then you're going to just answer the following questions and round the answers to whole numbers. This is a non-leap year. Remember, that's important because if it was a leap year, then we would be looking at 366 days. Now, one thing that I like to do is I have the days in each month, and then I have my little at a glance. January has 31 days, February has blah, 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 unless it's a leap year. Why do I have that? Well, as we go through these particular questions, it's going to be important to know how many days we're working with. So for the very first question, the first 6 months was 181 days. Okay, it's a non-leap year, very important. We take 181 days and divide it by 30,875 patient days of service, because we know that the very first 6 months, there were 30,875 patient days. This is going to give you 170.58. The directions, however, say to round to the nearest whole number, giving you the answer 171. So let me go over that again, okay? The very first 6 months has 181 days. You divide the 181 by 30,875, because we know that the very first 6 months, there were 30,875 patient days of service. The number we will get is 170.58. However, the directions say to round to the nearest whole number, which gives you the answer of 171. Now, for the second question, the same hospital's new surgery unit has 50 beds during July. The unit provided 1,705 days of service. What was the average daily inpatient census for the surgery unit in July? For this question, we look at how many days are in the month of July, okay? And at a glance, okay, there's 31. We take the 31 days of July, and then we're going to divide it by 1,705, which will give us 55. All right, so that's why it's going to be really key in knowing the days in each month. And I just do this for me. So it's like at a glance, I'm not really having to think, okay, I know, right? So July 31st, 1,705 days gives us 55 daily input. The average daily inpatient census for surgery in July was 55. We're not done. We have a couple more things to cover. All right. Now, here you'll notice that you have a chart. Your metropolitan hospital has a large, busy rehabilitation unit. The 30-bed unit reported the following inpatient service days of the week of April 6th. Okay. Now, these questions, we're looking at the information that has been provided, and we're paying close attention to rounding to 3 digits after the decimal, because that's what we need to look at. Using the information above, determine the average daily inpatient census for the week of April 6th through April 12th. Round to 3 digits after the decimal. Very important. 3 digits after the decimal. All right, so how do we do it? We take all of the inpatient days, okay? We add them together. Once you do that, you should have 196. So I'll give you a couple minutes to go ahead and add those all up. All right, so adding them all up, you should have gotten the number 196. The next thing you need to do is how many days are from April 6th to April 12th? There are actually 7 days: April 6th, April 7th, April 8th, April 9th, April 10th, April 11th, and April 12th. 7 days. Take the 196 and divide it by 7, because there's 7 dates that have been provided. Once you've done that, you will get 28. But remember, the instructions state to round to 3 digits after the decimal. And in this scenario, the whole number is 28, giving us the answer of 28.000. Now, for the second question, University Hospital is a 765-bed facility with 250,415 inpatient service days for the past year. What was their average daily census for the period? And we are rounding to the whole number. So paying really close attention to, is it decimals, 2 after, 3, 4, or is it a whole number? When you're doing this, you'll notice that if you don't put in exactly what the instructions say, it will mark you incorrect. A lot of this is like, okay, maybe this particular facility needs to see rounding to 3 digits after the decimal, versus another facility that's like, we're cool, just round to the whole number. For the second question, we look at what the question is actually asking us. We know that the university has a 765-bed facility with 250,415 inpatient service days for the past year. But we want to know the average for the past year. This is a non-leap year. There are 365 days in a year. What we do is we take the 250,415 and we divide it by 365. This is going to give us our daily census. But remember, we round it to the whole number. So I'll give you a couple of minutes to take 250,415 and divide that by 365. And I'm going to do it right now with you. Pulling out my calculator. You should get 686.068493. So going back to rounding, right? We look at the number directly after the 6, which is a 0. Even that 6 after the 0 would only round it to 1, but that is not going to affect that 6. So we know that the daily census rounded to the whole number is 686. Okay, so like I mentioned, this right here is a huge key for me because it really helps me to kind of at a glance. Now, mind you, I could definitely be like, okay, I know it, which I do, but it's good to just have a, way to, one less thing that you're having to kind of figure out and be like, okay, let me remember which month has this and which month has that. It's also helpful because you never know, you may get a question in the future that says, this is a leap year. Now, mind you, if that's a leap year, it's not going to change the last 6 months, but it will definitely change the first 6 months and it'll definitely change the year. So paying very close attention to that information will be very helpful as you navigate through these particular problems. Now, moving forward, we're going to always do some of the apply and reflect here in the live sessions. So if there's something that you're like, I keep getting this wrong, I'm not really sure what's going on, this is going to be the time where you can pop in and ask your questions, because you never know, the question that you have, someone else may also have it and they may not know how to express it. And remember, we're here together as a team. All right. With that, remember I mentioned that I'm still going to randomly pick 2 knowledge check questions for us to review / preview. And our very first question, these are random. So if you haven't done your knowledge check yet, you may get this question and you will be 1 step ahead of the game. The time for taking the inpatient census must always be, is it consistent? Is it 11:59 a.m.? Is it 12 p.m. or is it variable? Give you guys a minute to kind of throw your best guess in. Best guess in. And hopefully everyone chose dun, 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 consistent. And for our next question, all right. Metro Hospital has a 30 bassinet nursery. They have a total of 729 newborn service days for the month of May. What is the average daily census for May? And then round to the nearest whole number. Go back to remembering how you do this in the first place, okay? Is the answer 22, 23, 21, or 24? Remember what you may have to do. All right, so everyone should have divided 729 by 31, because there are 31 days in May, which would give you 23.516129. But once again, this is asking us to round to the nearest whole number. That 23.5 rounds to 24, okay? And this was our quick knowledge check preview / review. Okay, we're talking about numbers. So for everyone watching the playback, this is for you. I would like you to find the #1 box office movie that was playing the year you were born. I repeat, we're talking about numbers. So I would like you to find the #1 box office movie that was playing the year you were born and what it opened up with. For example, I will start with me. Mine was Grease, and it opened up with $181,813,770. Don't place your year, attention to detail. Don't place the year of the movie, but find the movie and let's see what movies were #1 the year we were born. So we went over our math trivia. Do you guys remember what it was? Do you? What number doesn't have its own Roman numeral? 0. And then our little math words were, how many times has this happened to anyone, right? You're doing a math problem, you're feeling confident, you're taking everything down, doing your subtractions, your multiplications, you're feeling like, yes, I got this. And then you look down at the choices and realize that none of the answers on the page reflect the answer that you came up with, right? So it's that awkward moment when you find a math problem and your answer isn't even one of the choices. We recapped our apply and reflect for week 1, just going over, I know most of everybody's already submitted it, but kind of if there were any questions with any of those problems, we were able to just kind of review them, okay? We went over a lot of definitions and talking about patient census and differentiating the different terms related to chapter 3. We also went over a couple of the apply and reflect assignments from this week, okay? And it's gonna really give you that confidence that, you know what, you got it. We didn't cover every single question, but we covered a good portion to kind of guide you onto how to navigate through this health statistics class. And then we finished up with a couple of knowledge check review preview questions. And this is our wrap up. I want to stress that if you have any questions or concerns, I know that this is a lot of math, to please reach out. Do not hesitate. Our office hours are Monday at 10 a.m. You can always pop in, let me know, hey, Miss R, Professor Rulak, I need some help with this. Just pop in. That's what we're here for. That's the purpose of the office hours. Also, as you're navigating through your knowledge checks and your apply and reflect, especially your knowledge checks, try to score a 90% or higher. It will definitely help you as you complete your feedback that is due on Sunday by 11:59 Pacific Standard Time. If there are no questions or concerns, I want you all to have a wonderful rest of your week. Be safe, and I will see you next Tuesday. All right. Have a wonderful day. Bye.